At the EBCC conference, we had the opportunity to present the preliminary results from an ongoing trial on PET MRI in early breast cancer. This trial was titled S&B versus PET MRI 2 and is directed by Professor Oreste Gentilini, who was awarded a national grant by Italian Ministry of Health in 2018. PET MRI is a hybrid exam which offers the unique opportunity of having at the same time both an evaluation of the locoregional extent and of the metastatic spread of breast cancer disease. Eligible patients in this trial were patients with early breast cancer who had clinically negative lymph node in the axilla, and they underwent a preoperative PET MRI with FDG. The primary aim of this trial was to evaluate the capability of this exam to stage the axilla when compared with the standard of care, which is sentinel node biopsy. Although this trial is still ongoing, so we are still completing the accrual, we decided to carry out an unplanned preliminary analysis to evaluate the impact that this preoperative exam had on the therapeutic pattern of 205 enrolled patients. As a result, we found that in 27.8% of the patients, results from this preoperative PET MRI, from this additional exam, led to a change in their therapeutic pattern. So, in detail, 14 patients started a neoadjuvant chemotherapy, 4 patients were diagnosed with a metastatic disease, 9 patients required a mastectomy instead of the initially planned breast conservation. Bilateral surgery was necessary in 12 patients. In 6 patients, thanks to an oncoplastic remodeling, we performed an extended wide local excision. And furthermore, in 12 patients, the axillary surgery was changed, and instead of initially planned sentinel node biopsy, patients underwent axillary dissection or at least an axillary nodal sampling. Of course, these results are preliminary and the study is still ongoing, but we saw that the PET MRI, FDG PET MRI, could have a potential utility in the management of early breast cancer patients. However, the risk of false positive results exists, and this could lead to overtreatment. This is why these results need caution in the interpretation, and in case of new findings with PET MRI, we always suggest a confirmation with further biopsy. Future trials should be planned on this topic because we need to clarify which patient cohort could benefit the most from this exam. We should also consider that molecular imaging could allow us to better tailor the imaging methods on the basis of tumor biology, as it happens for surgery and systemic therapy as well. Well, looking back at our preliminary results, we realized that the performance of FDG PET MRI is not equivalent for all tumor subtypes. In particular, if we look at tumors with the low metabolic activity like luminal A breast cancer, or tumor like a particular morphology like such as a lobular breast cancer, these tumors showed a poor FDG uptake, and this could impact on the accuracy of this exam. So starting from these premises, the FESTA trial was born. This is a new study which aims at evaluating the performance of PET MRI with a novel radiotracer, which is called the fluorestradiol, and is able to bind the active estrogen receptors on the tumor surface of luminal A and the lobular breast cancer. Thanks to this project, I was awarded a national grant from Associazione Italiana Ricerca sul Cancro, AIRC, and we are going to start very soon with using FES PET MRI in different settings of breast cancer. So the recruitment will start soon, and my hope is to achieve interesting results in the next 5 years.